Hello dear viewers, and welcome back again right here at Good Morning Kuwait. And as always, we promise you with the latest guest right here, and we're actually going to discuss a topic that combines a medical expertise with the art of aesthetic balance or cosmetic surgery with a focus on forehead shortening procedures. Now we're joined by a specialized cosmetic surgeon to walk us through everything you need to know: what the procedure is, who it's for, how it's performed, and how it compares to other treatments like brows, lifts, and hair transplants. We'll also cover safety, expected results, recovery, and potential risks. Now we are pleased to have with us today our guest, Dr. Nadi Sakr, specialist and plastic surgeon. Hello, and welcome to the show.
Welcome and good morning, Kuwait. I wish everybody have a nice good morning.
Yes,
today.
We're actually having a great morning, and
yes.
We hope to you too.
Yes, thanks.
So talking about forehead shortening, what is it about? Can you give us like a brief, short understanding, meaning?
Okay, this forehead shortening is a new technique. Maybe 4 years ago it was not known, and it is intended to shorten the forehead because some people complain about very long forehead that draws too much attention to them.
All right. With that, of course, you're talking about just the procedure of doing a surgery on the skin itself, not on the bones and all that.
Yes, that's why I prefer to call it forehead shortening, because actually we shorten one dimension, which is the height of the forehead. It's not forehead reduction, because forehead reduction, it can reduce muscle, it can reduce bone, it can reduce the whole surface area of the forehead, but actually it's forehead shortening. We shorten from here to here, and that's it.
Yeah, it also reduces the space of the brain where it actually sits, and that's a problem.
It's just the skin.
No, I meant the other procedure.
We don't go to the bone, we don't go to the brain or to anything of the dangers.
All right, so what are the main reasons patients choose this procedure? It's mostly aesthetic, or are the functional benefits as well?
Actually, it's aesthetic origin. People seek to do this forehead shortening because maybe when they are young, they are bullied by other colleagues at school. They find that forehead draws too much attention to them. So instead of the attention being drawn to the beauty of the face, of the eyes, or other beautiful features of the face, the attention is drawn to the long forehead, and they get some bad comments, and that's why they seek to improve it and to get less attention about this area.
All right. So who are the ideal candidates? You said one is people that actually have long foreheads, so it draws attention for being bullied. What are other candidates are we talking about?
Actually, people come to us primarily for long forehead. Usually the forehead in females, in women, it should be about 5 centimeters, and this upper third of the face should be equal to the middle third, should be equal to the lower third approximately. So when there is imbalance between the forehead, and the forehead is usually larger than 6 centimeters in height, or the hairline is on a horizontal part of the because the forehead is usually vertical, and then the hairline starts. Yeah. If the forehead starts to turn horizontal and the hairline is on the horizontal part, this gives the impression of baldness or the impression of very long forehead, although it may not be very long. That's why at this situation we start to do the surgery.
All right, perfect. Now could you tell us, now we're going to get into the details
yes,
of how the procedure actually goes on. So can you give us a more detailed way or procedure of actually doing this kind of surgery?
Actually, it starts in the consultation. We discuss the patient about the benefits and risks of the procedure. We draw actually with a marker on their forehead what we are going to do, and of course they have to have realistic expectations, because maybe they choose to reduce their forehead 4 centimeters, but this is not good for them. It will make their forehead shorter than normal, and there will be attention drawn to them because of short forehead instead of long forehead. So this is an operation of balance. We return the balance and the beauty of the face to the correct dimensions. So when we discuss with them the amount that we are going to reduce, and they agree to it, and we started to do some lab investigation, and we decide with them the type of anesthesia, whether local or general, and they have anesthesia consultation, and then we can proceed to surgery.
All right. So there is a picture you actually you provided us with, and it shows that the forehead itself, how it's being right over there, how it's the difference between before and after, how you know, long forehead.
Yeah.
But this is a receding one. This goes back.
Yes, yes. Most of the patients are like this, and as I told you, as in this picture, the frontal hairline, it lies on the horizontal part of the forehead, and after the surgery it lies on the vertical part of the forehead because the forehead is shortened, and in most cases we are able to decrease the forehead about 1/3, which returns it to normal. Like if the patient comes to me with a 6.5 centimeter forehead and I reduce it 2 centimeter, it becomes 4.5. So it becomes 1/3 less. If the patient comes to me with a 7.5 centimeter and I can reduce it 2.5, so also they become 1/3 less. So actually, the dimensions are not very important. The very important thing is that we make the forehead does not draw attention.
Yeah.
If it does not draw attention, so the operation succeeded.
You say that these small measurements are not important, but it is actually important if you think about it. People do come in just for those small adjustments, but in the end of the day, it does change their life. It's the same thing when you're talking about people that don't have a good smile, and then you fix their smile, it changed their confidence.
Yeah. But what I want to tell you that some people with me after the surgery, they end having a forehead like that is 4.5 centimeters. Some people end having forehead that's 5. Some people end having forehead that is 5.5, and all of them happy, and all of them have self-confidence. Why they have self-confidence despite different measurement? Because the forehead does not draw attention anymore.
All right. So what does it differ from brow lift and hair transplant? Also, what is the anesthesia is typically used for forehead shortening?
Actually, many people confuse forehead shortening with brow lift or forehead lift, but actually they are quite different procedures.
Yeah.
The forehead lift is intended to improve aging forehead, to reduce wrinkles in the forehead, and sometimes raise the outer part of the brow, so the forehead moves upward and backward. But in the forehead shortening, the intention is to reduce the height of the forehead by moving the scalp forward. So actually, the forehead remains in place, and the scalp comes to meet it at a lower position. That's why they call it hairline lowering procedure, or also sometimes. And the anesthesia, most of the, maybe 90% of my cases, I do under local anesthesia, and it's doing very well.
Yeah. How long does it take actually to do the procedure?
Actually, in most of the cases, it takes about 40 minutes to 45 minutes.
That's why you use local anesthesia?
Yes, but I have a trick that when we are about to start surgery, I tell the patient, can you prepare a story or an adventure that happened in your life when you were traveling abroad for tourism, and then you recite this to me. And most of them, they can recite something that takes about 20 minutes, and they don't know what is going on, because the surgery, if you see it, is terrible surgery. But if they are, I withdraw their attention away from the surgery, things go very well under local. I'm
sure some of them even had more than 40 minutes, and they tell you, doctor, I need to finish the story, please. I can't.
If they stop telling story, I start telling my own story.
So, are there any other cosmetic procedures that can be safely combined with forehead shortening?
Yes, many patients, because the forehead and the brow are in the same area, many people, maybe 1/3 of cases, they choose to combine forehead lift or brow lift with the forehead shortening, because they are done from the same incision. So the patient do 2 operations with 1 scar, which is a good benefit to them, and also they are in the same area, so we don't add too much amount of anesthesia, only maybe little amount, and we do both procedures.
All right. So is there any complications that can result in this operation?
Yes, it's like any procedures, any surgical procedure, the complications are possible, but I assure my patients that it's a very rare complication, and no one case has any major complication. It's just like little bruising, little edema, and the scar, of course, they have to expect a scar in their forehead, but maybe in 98% the scar is excellent. Nobody complains about the scar. With just the minimal creams for scar, they all get a very good to excellent scar.
All right, now talking about the recovery, could you give us step by step what is the recovery procedure and period?
Yes, the patient, when we have done the operation, the patient goes out of the operation room with a crepe bandage tied around their head. The aim of this is to decrease edema and to decrease bleeding or blood collection inside the operation site. After 3 days, they come to me, they remove this wrapping, and they have only very small tape, like we call it strips, on their wound, very small like this. And the edema subside in about 5 days. The bruising rarely happens, but when it happens also subside within 4 days. So maybe on the 5th day, they can start to work and bit by bit resume their normal daily activity. And the pain, regarding the pain, of course, we prescribe antibiotic and painkiller. Most patients tell me that the pain is moderate only for the first day, and from the second, third day is very, very little pain actually.
All right. Now we're talking about scarring. Usually there are people that their scar might still stay on. So how can we actually, remove that?
Actually, the care of, in my hands, the care of the scar starts inside the operation.
Of course, yeah.
It starts inside the operation by choosing to put the scar at the hairline, which camouflage the scar. We use state-of-the-art suturing techniques, like in many layers, like we use permanent sutures to hold the skin together. That also decreases the possibility of the scar. And we use some technique called the trichophytic incision, because as the hair is like this, we cut it beveled like this. So the hair roots remain inside the incision. So in the coming 2 to 4 months, the hair starts to grow inside the incision. When the hair starts to grow inside the incision, it camouflages the scar very well.
Yeah.
This is
so it's not camouflaging behind or in front of the hair, it's on the hair.
At the hair.
Exactly.
And when the hair is dense, it can cover the scar. And the growing hair also covers the scar. After the operation, we use many creams, many silicone sheets. Also, it will improve the scar. So most of the people actually get a good scar after 2 to 4 weeks of the operation. And because of this area and the hair, there are many ways to cover the scar, like the haircut. They can choose a haircut that covers the scar. The makeup can cover the scar, and the scar creams. Very rarely, some people need laser some laser sessions to improve the scar, but all of them are happy.
So, doctor, unfortunately, we've reached the end of our discussion. But before that, would you give an advice to people that want to do this procedure? How can they actually be okay or take the step to do it?
Actually, when the people start to complain of long forehead, they have some bullying, they lose some self-confidence, they can seek a consultation with experienced surgeon. They have to use someone who has good qualification, they have experience in the surgery. They should ask the doctor to show them before and after photos of his patients. They can go to the Instagram account and see what the doctor can do and what he cannot do. They can ask also for testimony from previous patients. And when they get confidence in the doctor, they can start to do the surgery with big success.
All right. Thank you so much, Dr. Nadi, and we hope to see you soon again. And thank you so much for actually showing us the steps into how to do forehead shortening.
It was my pleasure. Thank you very much.
Anytime. Thank you so much. All right, dear viewers, that was Dr. Nadi Sakr, a specialist and plastic surgeon. Now we're going to take a short break, dear viewers, so stay tuned and don't go away, because we'll be right back for more right here at Good Morning Kuwait.